You are welcome to my channel. Thanks for visiting. If you haven't subscribed, please remember to do. But if you are subscribed and you are visiting again, I'm saying a big thank you. Today, still on schistosomiasis, but this will be the last topic on schistosomiasis, and this will form the 8th presentation, number 8, on schistosomiasis. It is all about how to make accurate diagnosis of this parasitic infection. So, without further ado, please, let's go and get all the steps to making accurate diagnosis of the exact species of schistosomiasis. For us to understand everything about accurate diagnosis properly, it will be better to go back and revise some of those stuff we've learned here. This will be about the life cycle of schistosomiasis. That will be helpful here. Also, this will be about the treatment. You can click on this very link to take you there. And this is about neuroschistosomiasis, specifically the treatment. This will be the link. And lastly, signs and symptoms will be very helpful. If you click on this link, this will take you to the signs and symptoms of schistosomiasis, and that will be helpful right here. Now, we will need to take samples, and that will take us to taking stools, urine, serum, the blood, sometimes lumbar puncture for cerebrospinal fluid, biopsies, and bronchogenic washing, and then take the aspirin. What are we going to get from those samples? X, polymerase chain reaction for DNA, the antigens, and of course antibodies when there is host response. If you want to know the exact species of the parasite you are dealing with, the best will be microscopy of the X and polymerase chain reaction DNA. For travelers, the first sign when it comes to making the diagnosis of schistosomiasis might likely be eosinophilia. That may be the first clue. Let me explain. I'm the physician now in the Western world. A patient is before me for something else entirely. Then, complete blood count has been done with differentials, and there is high level of eosinophils. Other possible causes of high level of eosinophils have been ruled out. Then, the next thing is history of traveling. If the travel history is pointing to visitation to the endemic zone, might not be schistosomiasis alone, any parasite whatsoever, that will give a clue that I may be dealing with parasite here. Then, antigen antibody in the serum. If serum is positive for antigen antibody, then we'll have microscopy for X. Don't worry, I'll go into details as per microscopy for X maybe. If the individual before me is asymptomatic, but there's history of travel to the endemic zone, and I'm concerned about schistosomiasis, has been a problem. I don't want the patient to come down with horrible complications later in life, for example, infertility in a woman of childbearing age. Then today, I may have microscopy for eggs done. I can have urinalysis, particularly when there's hematuria, and of course circulating antigens for screening. We can have complete blood count with white blood cell differentials. I'll be looking for high level of eosinophils. All this could be done in asymptomatic individuals, but with a positive history of contact with contaminated water with Secari. Now, we are moving a step further into a scenario involving an individual that is symptomatic. For us to get the reason why we want to do what we're about to do, please check back on the life cycle of schistosomiasis that I've already published. And also check back on the signs and symptoms. Because before you get signs and symptoms, there must have been a kind of reaction between the antigens produced by the eggs and the antigens produced by the adult worms and the host immune system. When the antigen antibody reaction is ongoing, that is when we will have signs and symptoms. And that is the reason in symptomatic patients, the first thing to do is serum antibody, because we will not have symptoms without host immune system responding to the antigens already produced. Then we can also estimate the parasite burden by microscopy. Microscopy for eggs in stool or urine, depending on whether we are dealing with the rest of species or Schistosoma hematobium, respectively. So the microscopy for eggs is the gold standard. Why that? If you go through the life cycle again, I have published a small sketch distinguishing the different types of eggs that is peculiar to a particular type of Schistosomiasis species. Okay, like one with terminal spine and the other one with lateral spine, and so on. Just check back. Then schistosomal circulating antigen, like circulating cathodic antigen and circulating anodic antigen. We will do all those in an individual that is symptomatic immediately. Now back to microscopy for eggs. Because it is the gold standard, so let's examine it more and more. Direct microscopy is the easiest and the most practical way to diagnose schistosomiasis to the exact species. Microscopic examination of the eggs could be done using the stool or the urine. We will talk about Kato-Katz and formalin ether in a bit. Microscopy with direct fecal smear will be more accurate. Okay? You can use urine for Schistosoma hematobium and its hybrids. But listen to this. We'll collect that urine within certain hours of the day. Some authorities will say between 10 a.m. and 2 p.m. Some authorities will say between 11 a.m. and 3 p.m. Well, they're not so far apart, right? Okay. That is for Schistosoma hematobium. And we can increase the urine sensitivity by using the precipitate after centrifugation or after urine filtration. That will increase the sensitivity. Let me go back a little bit to the stool for direct microscopy. You can use stool here for all species, including Schistosoma hematobium. But if you really want to come down or get to Schistosoma hematobion with history of hematuria, I would rather use both. I will use the urine and use the stool for direct microscopy. Then it means there's no doubt anywhere, because someone may be infected by two species at a time. Yes, it depends on the Cercaria, the molars that is available, within the community where you are. It's likely. So if that is the case, like people traveling up and down, moving from one zone to the other, moving from one country to the other, getting Schistosoma hematobion in one place, the following week is in another country and swimming in the river, doing everything and becoming contaminated with Soma Masona or Japonicum or Intercalatum in another community, then I will be sure that I'm truly dealing with the exact species through direct microscopy. Now, still on microscopy for eggs, the epidemiologist who will likely use direct microscopy for eggs for investigational purpose will use Kato-Katz technique. Okay, so they are going to use the egg output to make their determination. This is for investigational purpose. The FECT is all about formalin ether concentration technique. This is helpful if you are dealing with Schistosoma japonicum. And the reason is that Schistosoma japonicum will have small eggs. So if that is the case, please go back and review the life cycle again and also the epidemiology. The patient is symptomatic and we want to determine the intensity of the infection. Okay, we can do that. We can find out. Are we dealing with light intensity, moderate, or severe? It is going to be light intensity when we are dealing with about 100 x per gram. It's moderate when it's about 100 to 400 x per gram, and it is severe when it is greater than 400 x per gram. Lung involvement. The eggs, when there's pulmonary schistosomiasis, will be picked through bronchoscopy washing. Some call it bronchogenic washing, and then you get the aspirate and look for the eggs. You can also have transbronchial biopsy and send to the lab for histopathology when there is involvement of the pulmonary system, pulmonary schistosomiasis. Remember, called pulmonary. Okay. We can have serological or immunological investigation done. Why that? Remember, I said antigens will be produced by the eggs. Adult ones will produce antigens. The host immunity will determine the level of response, and that will determine the signs and symptoms. So it is not out of place to be going for the serological test, because that is why we're having the signs and symptoms. So let's check. Polymerase chain reaction, enzyme-linked immunosorbent acid, indirect hemagglutination acid, radioimmunoacid, and Western blot. All the listed tests are pretty good, but polymerase chain reaction will have some special advantages. And that will include it can be used to measure parasite body. 1, 2, It can be combined with antigen tests to improve and to monitor eradication progress. And 3, its sensitivity and specificity in early infection and non-endemic settings is more encouraging than the rest. And 4, it may be useful for early diagnosis of new or recent infection. And 5, some can even identify the exact species. Remember, I said it the other time, if you want to know the exact species on time, you go through 2 routes. Number 1, direct microscopy for the X, then polymerase chain reaction for the DNA. And lastly, the special advantage here is that polymerase chain reaction using cerebrospinal fluid is good enough to make the exact species that is causing Schistosomiasis. Now, still on serology or immunological means of diagnosis, these will play a very, very important role in determining whether or not we are winning as per the treatment. So loss of antigen is equivalent to cure. Let me repeat. Loss of antigen when you are using serology is equivalent to cure. Now, in all, serological tests are negative in acute infection. It will become positive at 6 to 12 weeks or even greater than that. So that is part of the shortcomings of serological investigations. Antibodies can remain positive for years, even after adequate treatment. So we need to watch all these things while interpreting our result when it comes to serological or immunological investigation. Better results or higher sensitivity will be the case when we combine the X antigen test with adult one's antigen test. We'll get better outcome when we do that. Let's be cautious when we are dealing with serological investigations with schistosomiasis and we're trying to interpret the results. The antigens, when it comes to the egg detection by using antigen is not so sensitive. No. But when we use polymerase chain reaction, that is pretty fast. It's more accurate than using antigens from eggs when we are comparing the two. So we'll rather go for polymerase chain reaction. Okay? Antigen testing can be used to determine the treatment efficacy. Yeah. Now, let me go to something very small here, but very helpful. In Schistosoma hematobium, you can inject intradermally schistosome antigen, and that can help because it will then form a wheel. When that is the case, then that is good enough to say that you are dealing with Schistosoma hematobium infection. Let me repeat what I meant by this. If you have the antigen of Schistosoma hematobium and you inject it intradermally to the patient you are suspecting of having Schistosoma hematobium or not, if a wheel is formed, then that is telling you that, yeah, there is Schistosoma hematobium infection here because antibodies would have been formed. For serological investigations and immunological investigations, you know that we are going to be dealing with antigens from adult worms and antigens from eggs. Now, let's talk briefly about the antibodies. Even after complete and proper treatment, the antibodies will still persist, and it may be like that for many years. So the level or the presence of antibodies is not a good measure when it comes to follow-up. Antibodies are usually detectable most times even before the eggs are detected. Antibody test assays are not species specific. They are not. But when we pick the antibodies, then we will be sure that there is schistosomiasis in this system. So we should now take note of that. Disadvantages of immunological investigation is that it's only positive at a certain time, and it can be positive when other helminths are the ones causing the infection. Now, biopsy. We will not need to have biopsy if the gold standard, which is microscopy for eggs, is solving the problem for us. But when the microscopy for eggs is negative, then we go for biopsy when we can't pick eggs and it is a chronic infection. We go for biopsy. The biopsy could be taken from rectal biopsy, bladder, urinary tract polyps, and scrapings from genital lesions. When do we need ultrasound? We need ultrasound when we have hepatomegaly. Remember, parasinusoidal fibrosis and portal hypertension. Then hepatomegaly and splenomegaly. When we have schistosoma hematobium with renal system involvement, we can have ultrasound. When an individual is down with any of the species and he or she is presenting with abdominal pain, we have ultrasound. Perineal bleeding can have abdominopelvic ultrasound done. X-ray will be necessary when there's lung involvement or pulmonary schistosomiasis, or is bad enough to have caused trouble with the heart called pulmonary. We will need abdominal X-ray, or in this case we have chest X-ray done. We will need abdominal X-ray when there's intestinal or abdominal enlargement, or we are down with obstruction or stricture. So we want to know, is this small bowel or large bowel obstruction? Then we have abdominopelvic X-ray done when we are faced with genital urinary system involvement. CT or magnetic resonance imaging will become necessary in the phase of neuroschistosomiasis. Other tests that we will do here will include lumbar puncture for cerebrospinal fluid, and then biopsy of the central nervous system lesion. Monitoring. We can monitor the treatment, whether we're winning or not, using microscopy for eggs. I don't need to waste your time. You can reverse back. Then your polymerase chain reaction for DNA can also help us. Some gut-associated antigen like circulating anodic antigen or circulating cathodic antigen could also be made use of. Lastly, other useful investigations will remain complete blood count with differentials. There we check the platelets, that is thrombocytes. Remember, I've talked enough or eosinophils. We should rule out Clostridioides difficile, formerly known as Clostridium difficile, when we are faced with diarrhea. Then we can have microscopy, culture, and sensitivity done when we are suspecting secondary bacterial superinfection, because that will afford us the opportunity to select the appropriate antibiotics. With that, I've come to the end of this presentation, and that will mark the end of all presentations on schistosomiasis, and this will be the number 8 presentation on schistosomiasis. Please kindly share all these presentations with your friend or with your friends on your platform. Thanks for listening. Please remember to subscribe. I appreciate it.